Good afternoon, Bahamas. Thank you for joining us as the Ministry of Health provides our COVID-19 update. As usual, we will begin with our minister, and then that would be followed by myself, and then we will entertain questions from the media. Honorable Minister.
Good afternoon and Happy New Year, Bahamas. Deep gratitude is extended to Almighty God for helping us to see another year. I believe that this year, 2021, will be a momentous year of renewal, of hope realized, and prosperity in abundance. I speak this through the eyes of faith. The year 2020 is now history. It was a year of infamy and a year in which the Bahamas rose to meet the challenge presented by the COVID-19 pandemic. For 2021, we encourage all Bahamians to create positive moments and opportunities. May we remember the lessons learned from the previous year while we remain optimistic about our future. We began last year with many unknowns about a novel coronavirus. This year we have more knowledge, and knowledge is power to navigate our destiny. Ladies and gentlemen, here is the latest national COVID-19 report. On Thursday, the 7th of January, 2021, there were 10 newly confirmed cases of COVID-19. This brought the total number of confirmed cases in the Bahamas to 7,969. Total COVID-19 hospitalizations currently continue on a downward trend and now stand at 11 from 15 on January the 1st. Currently, there are no COVID-19 patients as recovered from COVID-19. This brings the total number of recoveries to 6,313 for a recovery rate of 79.2%. Fortunately, there were no deaths confirmed yesterday. The total number of confirmed COVID-19 deaths now stands at 175. Non-COVID related deaths are at 37. 15 deaths remain under investigation. One COVID-19 death to us in the Ministry of Health is one too many. As minister, I continue to pray for the families across our archipelago who have lost loved ones to this pandemic. Let us pause for a moment to remember our loved ones and friends that were lost in 2020. Ladies and gentlemen, a total of 54,244 RT-PCR tests have been carried out for COVID-19. 402 tests were performed yesterday, with 10 positives and 387 negatives. 3 tests were repeat to determine recoveries. It is noteworthy to mention, for the first time, we're seeing COVID-19 cases in San Salvador. The total number of cases in that island currently stands at 7. Again, we thank our healthcare and essential workers for continually and devotedly performing their duties on the front lines. It is because of your professionalism, sacrifices, and dedicated service under the guidance of Almighty God that has brought us this far. Please be assured that your works have not gone unnoticed. We applaud you for your consistent diligence. Ladies and gentlemen, the Ministry of Health was concerned that some Bahamians may have chosen to travel during the Thanksgiving season of November 2020. We know that Bahamians like to shop. Many have the customs to travel to the United States to take advantage of the annual Black Friday sales. It is noteworthy to mention that on the 9th and 10th of December 2020, which marks the end of the 14-day incubation period for COVID-19 after Thanksgiving Day, we did see a spike in newly confirmed cases. 38 cases were reported on the 9th of December 2020, and 25 cases were reported on the 10th of December 2020. Since then, the Bahamas has experienced a low number of newly confirmed cases, ranging from 4 to 19 per day. This outcome has made possible because of our traveling protocols. The use of the gold standard of the RT-PCR test to evaluate travelers before coming to the Bahamas has proven to be most effective. Further, our surveillance activities have ensured follow-up testing after traveling outside the country. Quick isolation of those who have fallen ill has reduced the spread of the virus. Additionally, mandating travelers to purchase travel insurance has created easier access to immediate healthcare and medical evaluations. This ensuring non-residents who become ill with COVID-19 do not become a burden to the local healthcare system. Ladies and gentlemen, we owe the Bahamian public a debt of gratitude for continually adhering to the preventative measures. It is because of your discipline we saw low numbers for the Thanksgiving season, and we are experiencing low numbers of newly confirmed cases right now. Let us all remain vigilant and continue to demonstrate responsible behavior. Remember to wear your mask in stores, at work, around family members and friends. Disinfect grocery trolleys, baskets, and purchase items brought into your home. Use hand sanitizer when you enter and exit stores. Maintain 6 feet from others in your space, and wash your hands frequently, and remind your children to do the same. Make in-person circles just a little bit smaller. Move to outdoor spaces when possible, and use technological abilities to enhance and maintain your relationships with family and friends virtually. On behalf of the Ministry of Health, I say thank you for adapting to this new way of interacting. As the world continues to fight COVID-19, the methods may differ, but the commonality remains the same, which is the applications of these preventative measures. Your continued adherence to these measures now can and will determine our national circumstances later. Ladies and gentlemen, now that COVID-19 vaccines have been produced, the government of the Bahamas is working on all fronts to secure the vaccine. Currently, there are 3 authorized COVID-19 vaccines on the world market: Pfizer, BioNTech, Moderna, and Oxford University AstraZeneca. There are over 200 other COVID-19 vaccines in preclinical or clinical development. Given the global impact of this pandemic, scientists have been working carefully and systematically to produce safe, effective vaccines. Through the COVAX facility and with the assistance of the World Health and Pan-American Health Organizations, the Bahamas has presumptively secured enough doses to vaccinate 20% of our population once available. The government of the Bahamas assures its citizens and residents that the vaccines chosen for use will be safe and appropriate for distribution throughout our family islands. To facilitate this distribution, a national COVID-19 vaccine strategy plan has already been approved by Cabinet. and a COVID-19 vaccine national consultative committee has been established by the Prime Minister to safely introduce the COVID vaccine in country. This committee will give advice to the Ministry of Health's National Immunization Coordinating Committee and the National Immunization Technical Working Group, the NITWG. Be assured, government's objective remains the same: to continually provide free vaccines to all who wish to benefit from the protection that vaccination offers. Again, let me state the policy of the government of the Bahamas. The COVID-19 vaccine will be given without charge, without cost, to the Bahamian people. And uptake, acceptance, injection of this vaccine by the Bahamian people will be completely voluntary. Ladies and gentlemen, within the past 2 weeks, new variants of COVID-19 have been announced in the United Kingdom and South Africa. The variations to the virus are associated with increased transmissibility. Greater transmissibility means that more people can become infected, hospitalized, or die from the disease. Current data on the virus, on this variant, is limited. It is also unknown how the variants will affect the efficacy of the COVID-19 vaccine. There is no current evidence to suggest that this variant, however, will not respond to the COVID-19 vaccine. But research is ongoing. It is important to note that it is natural for viruses to mutate. This variant has been recorded in over 30 countries. Our neighbor, the United States, confirmed reports of the variant in New York, California, Colorado, and Florida. With ongoing global travel, the potential for a new variant of the disease to appear in the Bahamas is a reality. In anticipation of a possible third wave, maybe with this new variant in the mix, the Ministry of Health's surveillance team continues to monitor our in-country virus trends. The quarantine facility remains activated. Contact tracing is ongoing. Hospital bed capacity is ready. PPE inventory and laboratory testing supplies are being replenished and topped up. And vaccine distribution plans are feverishly being implemented. Worldwide, there is a limited supply of available COVID-19 vaccines. This predicament, unfortunately, invites many unscrupulous and dishonest persons to prey on the fears and concerns of others by providing and selling counterfeit vaccines. Falsification, theft, and illegal advertising of sale of COVID-19 vaccines is a crime. And we in the government will be closely monitoring our national landscape to ensure that this does not happen. Ladies and gentlemen, I implore you to take heed. Do not purchase COVID-19 vaccines online or from any informal market such as the back of a car. When a safe and effective vaccine is available in country, the public will be informed and invited to receive the vaccine in specific groups at no cost. The vaccine will be made available at our government clinics and multiple other Ministry of Health approved facilities for ease of access and quick rollout. Although most recent conversations have centered around COVID-19 vaccines, I would like to once again remind the general public, especially our precious pearls and parents of young children, that routine immunizations remain extremely important and must be continued, especially during this time of COVID-19. It took the Bahamas many years for us to get rid of infections such as polio, mumps, and measles. So it is important to keep up to date with your child's immunization schedules so that they remain protected from vaccine-preventable diseases. Even adults who have not received all of their immunizations should complete their immunization schedule at any government healthcare facility at no cost. The National Immunization Schedule is on the Ministry of Health's website for ease of reference. Ladies and gentlemen, as we embark on our journey through 2021, we recommend that Bahamians not be consumed with the COVID-19 infodemic. COVID-19 infodemic is an overload of both accurate and inaccurate information about the disease. The potential for facts to become skewed by rumors, half-truths, and fears make it difficult to know if the information circulating is factual. Our government websites, World Health and Pan American Health Organization, Centers for Disease Control and Prevention, the CDC, and the Caribbean Public Health Agency, CARPHA, are some of the agencies that offer credible scientific information about health matters. I encourage you to visit these sites for updated global information. I also urge you to be a responsible digital sharer of health information. No matter how credible the information may look, perform a quick fact check to ensure that you are providing information to your loved ones that is truly accurate and credible. My fellow Bahamians and residents, as we continue to engage in our daily routines, please remember that following the health preventative measures can greatly decrease your risk of acquiring any form of COVID-19. May joy and peace be yours in abundance, and may the Lord of life, God Almighty, continue to bless this great Commonwealth of the Bahamas. I thank you. CMO.
Thank you, Minister, and good afternoon again, Bahamas. And I too add a Happy New Year to the viewing audience and our listening audience. The Ministry of Health reaffirms its commitment to improving the health and well-being of all Bahamians. We hope you will become a partner with us in this journey. A healthy Bahamas is a better Bahamas. With 2020 now behind us, we look forward to good things in 2021. Though our focus over the past few months has been directed to COVID-19, we must not forget the burden of non-communicable diseases such as hypertension, diabetes, and obesity, to name a few. Today, however, we share the latest update on COVID-19. Our first graph shows the duration of the first wave in blue near the bottom, in direct comparison to the second wave, which is the orange line. The second wave of COVID-19 continues to linger. It has been with us for more than 183 days and continues. This is more than double the time of the first wave, which was 88 days. The flattening of the orange line, however, suggests that overall, the second wave is coming to an end. There are, however, individual islands of the Bahamas that we continue to watch closely. We look a little closer at that in the upcoming slide. For the past 4 weeks, there has been an average of 12 new cases in the Bahamas. Although our incident new cases remain relatively low, there is a concern on some of our family islands, in particular San Salvador. San Salvador had remained COVID-19 free for all of the first wave and for over 150 days during the second wave. Within the first 2 days of 2021, however, San Salvador recorded its first 2 cases of COVID-19. As of yesterday, there's a total of 7 cases on that island. This is cause for concern, and we appeal to the residents of San Salvador to be vigilant in their physical distancing, mask wearing, and other public health measures to stop this spread before it starts. This serves as a reminder that COVID-19 is still with us, and we cannot let our guards down. We must hold each other accountable. Remind your friends and neighbors to pull their masks up and decline invitations to socialize. In this graph actually, the bars represent the new COVID-19 cases reported for the 28 days up to the 6th of January. The orange line shows the 7-day moving average for the same period. For the entire month of December up to yesterday, the number of new COVID cases have been fewer than 25 on any single day. Also note, the orange line is effectively horizontal or flat. We have a flat line, which is good, but we would prefer to see that line pointing downward. The horizontal line means that we are holding the fort, but downward would mean that we are winning the battle. In this next graph, it also represents 28 days up to January 6, 2021, but just for New Providence. As in the previous graph, the orange line shows the 7-day moving average for the same period. And it shows a slight but definite increase in the number of cases. This graph is a similar graph, but for Grand Bahama. As in the previous graph, the orange line shows the 7-day moving average for the same period. There is a definite decrease in the number of cases up until the end of December, but a slight increase as of January. And this should give us some concern. Again, we appeal to everyone to not let your guard down and practice social distancing. Continue wearing your mask and the regular hand hygiene. This graph looks at the family of islands. The orange line, 7-day moving average, suggests a definite increase in the number of cases. If you look at the orange line, you would see that we are having a slight upward trend as it relates to our family of islands. This may be reflective of what we are having going on in San Salvador. Next slide. The data for the second wave, shown in the orange bars, continue to show that younger age groups are becoming infected with COVID-19 when compared to the first wave. 64% of all COVID cases in the second wave were between the ages of 20 to 49. This age group coincides with the most likely to have a more vibrant social life and more likely to be engaged in the workforce. The good news in this graph is that we are keeping our elderly, our parents, our grandparents, safe. Let's continue to be vigilant. When we look at testing, the gold standard for diagnosing COVID-19 remains the real-time PCR test. Our national statistics on this epidemic continue to reflect results of the real-time PCR test. As of yesterday, a total of 54,244 tests have been performed in the local facilities validated by the National Reference Lab. Countries were encouraged to reach positivity rates of 5% or less. The Bahamas has achieved this, though, through collective action, sound public health policies, robust contact tracing, and robust enforcement. When we look at rapid antigen testing, we recall that to accommodate the expanding opening of the economy and increased airlifts, rapid antigen tests were incorporated into our testing strategy. In accordance with the Ministry of Health rapid antigen test protocol, all facilities performing this test must complete an application form and register with the Ministry of Health. The protocol with the application form can be found on our website, or relevant entities can email Chief Medical Officer at bahamas.gov.bs to obtain the protocol and the form. Approximately 70,000 rapid antigen tests have been performed for travel-related purposes. The database shows 113 have tested positive on the 5 days post entering the Bahamas. This is a positivity rate of 0.16%. 58.4%, or 66 of those, have been among tourists. These were traced to the capital and the second city, as well as Exuma, Abaco, Eleuthera, Long Island, Bimini, and the Berry Islands. 34.5%, or 39, have been among Bahamians. These were traced to islands of New Providence, Abaco, and Grand Bahama. Less than 1%, or 8, could not be categorized. Shifting now, we look at the topical subject of vaccination. The skepticism and concerns of the public around COVID-19 vaccination are real and should not be dismissed. Every Bahamian should know that we anticipate the COVID-19 vaccine being available in the Bahamas in the first quarter of 2021. Whether you get the vaccine or not is up to you, is entirely up to you. And as you make your decision, however, we share these facts. Vaccine development is a demanding process, and on average, it takes about 10 to 14 years. Development of an emergency approval for the COVID-19 vaccine occurred within approximately 1 year. Though a short time, this would not be the first time in modern history that a vaccine was developed with record time. The mumps vaccine in 1967 was developed in 4 years. The H1N1 swine flu vaccine was developed in 6 months. The H2N2 Asia flu vaccine was developed in less than 5 months. There are a number of factors that influenced the development and production of the COVID-19 vaccine. First, the COVID-19 pandemic forged partnerships within the scientific community and across borders. These partnerships resulted in dedicated focus on one common goal: beating COVID-19. Second, any research, regardless of its scale or global impact, requires funding as a major component. The research involved to determine the viability, safety, and efficacy of vaccines and other medicines is no different. The negative impact of COVID-19 on lives, health systems, and economies galvanized and, in some instances, shifted funds toward research development for the COVID-19 vaccine. This assisted with moving the vaccine to readiness. A third factor that accelerated the introduction of the COVID-19 vaccine to the market stems from the fact that researchers were building on prior knowledge. They were not starting from scratch. The culprit in the SARS outbreak of 2003 and the MERS outbreak of 2012 belongs to the coronavirus family. The virus that causes COVID-19 is related to this family. In January 2020, when research began on the COVID-19 vaccine, scientists had almost 2 decades or 20 years of learning about and understanding the coronavirus family. As a result, just 5 days after WHO notification of the first case of this disease on the 31st of December 2019, the complete genome sequence or genetic makeup of the virus was known. The whole genomic sequence of COVID-19 has about 50% similarity to the MERS-CoV, which is the virus that had caused the MERS outbreak. A fourth factor was a renewed culture and appetite for collaborating and information sharing. Also, research centers are accelerating the development time for SARS-CoV-2 vaccine, in part by testing vaccines in multiple animal species and at once. I will say this again. A fourth factor was the renewed culture and appetite for collaborating and information sharing. That would be among the researchers. And additionally, research centers are also accelerating the development time for a SARS-CoV-2 vaccine, in part by testing in multiple animal species at once and in parallel with small numbers of people. Usually, the process is in one animal at a time, and people after that. We will see more in this following slide. In this slide, what you would see is the comparison as it relates to the usual process for vaccines and what has occurred in order to have the COVID-19 vaccine accelerated development. As you will notice, and this is what we are aware of, vaccines must successfully complete a number of phases prior to approval for use. All of those phases are included in both scenarios. And according to the World Health Organization, as of today, there are 172 preclinical and 63 clinical COVID-19 vaccine hopefuls being tested. And as was communicated earlier, thus far there are only 3. So this highlights that even though we are at a place where we would have actually had the COVID-19 vaccine accelerated development, all phases would have been followed, and we have no reason to have concern regarding the safety of the vaccine. As far as long-term consequences go, there is just no way to know for sure before the long term has passed. Going by history, however, the most serious reactions to a new vaccine occur within weeks, not years, after being administered. Monitoring the performance of a vaccine in the short and long term is incorporated into our national immunization program and is a key pillar of the COVID-19 vaccination rollout strategy. As I wrap up, I would wish to show that COVID-19 vaccinations are already occurring across multiple countries. As of the 6th of January, 15.56 million vaccinations were reported worldwide. The World Health Organization has identified COVID-19 as one of the top threats to human health. A post-COVID Bahamas will not be possible without activating the 4th pillar of our response. That is vaccination of a sufficient number of Bahamians against COVID-19. Having a vaccine is only one piece of the puzzle. Getting the vaccine is another. In other words, having a vaccine is no good if we collectively do not roll up our sleeves to get the vaccine. Experts in the field have concluded that the benefits of getting the approved COVID-19 vaccine outweigh the risks. We strongly encourage you to make the decision to have the COVID-19 vaccine for your protection, for the protection of the people you love, and the prosperity of our nation. I end with this quote from President Akufo-Addo. What we know is how to bring the economy back to life. What we do not know is how to bring people back to life. Thank you for your attention. And joining me now to entertain the questions from the media are Dr. DeLon Brennan, Dr. Frank Bartlett, Dr. Sharita Moxie, Ms. Mary Walker, Dr. Danny Davis, Dr. Philip Swan, Dr. Jillian Bartlett, Dr. Nakia Forbes, Dr. Gina Archer, and Dr. Indira Martin. I now open for questions from the media. Thank you. Ms. Jimenita Swain.
Good afternoon, CMO. Good afternoon, Bahamas. My first question has to do with San Salvador. Can you say whether or not what accounted for those cases? For instance, were they on-island COVID cases or were they imported cases?
So we have a combination. I'll let Dr. Jillian Bartlett speak specifically to.
Good afternoon, Bahamas, and Happy New Year to all. The first case in San Salvador was a native of San Salvador that traveled from San Salvador into New Providence. And on trying to get back into San Sal during the travel health visa, was found to be positive by the real-time positive PCR test. So both of those cases were originating from San Salvador. There was no history of travel outside of San Salvador at that time. Over.
the additional cases, Dr. Bartlett?
Oh, yes, the additional 5 cases all also originated in San Salvador. There were persons that were having flu-like symptoms. And as we know, you cannot determine whether you're dealing with flu or you're dealing with COVID. So we would have swabbed them. So the additional cases also from San Salvador with no history of travel outside of that island. Thank you.
You have a second question?
Yes, thank you so much for that answer. My second question would be whether or not there were any hiccups in the management of, I guess, the visitors coming in. You mentioned the number of rapid antigen tests that were done, but were there any hiccups in the travel process for visitors or even in the hotels in that testing process as well?
Hiccups. Anything specific you're asking about? Just the processing?
The processing aspect of it, and for instance, in terms of travelers coming in, we know that there were some issues with the health travel visa. That's what I mean when I say hiccups in terms of those elements.
Okay, thank you. So certainly the health travel visa is managed by tourism, but we work closely with them. And I will ask Dr. Brennan, who is our liaison to tourism, to speak specifically to any concerns that may have come up.
Good afternoon. Thanks for the question. No, there were no known hiccups. Everyone who came into country is mandated to have a health travel visa. So everyone had that visa, and in order to get the visa, traveling internationally, you do have to have the real-time PCR testing. So that system is going very well. Most people who are going through the system know that if once they have their test results, their negative real-time PCR, and submit it in less than 24 hours, they get a response, either to say that they've been approved and they can pay for their visa, or that they have been denied, and specifically for what reason.
Thank you, Dr. Brennan. Kyle Joaquin.
Hi, good afternoon. My first question, a number of other countries, some in the Caribbean, if I'm correct, are getting their first batches of the vaccine. Just want to know what's the holdup with the Bahamas. Has a decision been made with which one we're going to go with? When can we expect to get it? And any other specifics?
Okay. Minister is offering to answer you.
Thank you, Kyle. Those countries in the Caribbean who are receiving of COVID-19 vaccines, I think you would realize that they are all British protectorates. They're still a part of the United Kingdom, and a part of the UK's policy is it's distributing vaccines to its territory. So you'd find the Cayman Islands, Turks and Caicos, the British Virgin Islands, those entities receiving vaccines. As I would have said in my statement earlier, the Bahamas government is aggressively seeking to procure vaccines, and we're doing all that we can to ensure that in the first quarter of this year that we'll be able to present a viable vaccine to the Bahamian people.
Okay. My second question, some physicians like former Health Minister Dr. Dwayne Sands have said a third wave is imminent and will perhaps be worse than the first and the second. He said things like travel and testing protocols should be tweaked. Any recommendations from the health team on this, or what's being done in preparation?
Well, certainly a third wave is a possibility, and we have continued our ongoing surveillance and monitoring, and we have also continued we have actually added, we incorporated the rapid antigen testing into our strategy, and we are continuing with the real-time PCR testing. The wider testing is good, but we have to always consider other indicators that we are monitoring. We are focusing on ensuring, and I think you would have heard that in the minister's remarks, we are focusing on ensuring that we are in a place of preparedness as it relates to another surge. Ensuring PPEs are topped up, ensuring we are our capacities as it relates to bed capacity, all those things that we recognize, well, lessons learned from the first and second wave, we are seeking to ensure that we strengthen those components as we hope that we don't have a third wave, but we recognize that it can occur. Matthew Moxie.
Yes, good afternoon, CMO. So my first question is, have we seen any cases of the new variant, and how are we screening and testing for the new variant? Do we have the capacity to do that?
Okay, so I can say we have not, and I have Dr. Indira Martin, who works at the National Reference Lab. She will be in a position to speak to, what will occur should, and how we will be in a position to say whether or not we have it in country.
Good afternoon. I heard a part of that question. I think what was asked was essentially what would we do to ascertain whether this novel strain is in country. So currently we do not have the capacity to do the test in country that is required to ascertain whether that particular strain is in country. The test is called genomic sequencing. And in order to carry out that test, we'll actually have to send it away to a reference lab, an international reference lab, when and if that does arise. Thank you.
Thank you. And to add to that, I would say we have the option of, we have the sub-regional option, the CARFA lab, who we collaborate with, that we can use, as well as we have the Pan American Health Organization, that we can use as it relates to ensuring that we do the necessary testing. And as we go ahead with our real-time PCR testing, we have taken into consideration the need for us to identify certain indicators for us to actually send off specimen to determine whether or not we have that any of the variant in country. You have a second question?
Yes, my second question is, what will it take for us to see the lifting of the 10 p.m. curfew? Or I guess that's scaling back a bit.
Minister, would you like to take that? Minister has not offered to take it, but certainly, okay, go ahead.
Certainly, we're guided by the health team in regards to how we conduct ourselves as a government with the curfews and the overall health protocols. So we're keeping an eye on our current situation, as I said in my statement, and obviously we're looking as to what has taken place during the Christmas and New Year's Day holidays, and based on what we see next week. As we all know, the virus has a 14-day incubation period, so we'll be looking around the 14th, 15th of January to see what our current circumstances is, and we'll leave that up to the Cabinet and the Prime Minister of the Bahamas to come back under health's guidance and recommendations as to how the country will progress forward.
Thank you, Minister. And certainly, you may recall that we actually monitor key indicators that we would use as it relates to making a recommendation for removal of any restriction or adding of a restriction. So those indicators are some of what we would have reported to you on today. And certainly, we will continue that monitoring and be in a position to make a recommendation should it be required. Rashad Roll.
Good afternoon. Can you give us statistics on how compliant travelers have been with the requirement to take the antigen test after 5 days in the country? What percentage of people required to get the test have gotten the test since November 1st?
Dr. Moxie has been closely monitoring the portal, and I will ask her to speak to that.
Happy New Year, Bahamas. Thank you for the question. I think for us to get a full appreciation of The question about compliance, I would reiterate something that CMO had already mentioned, that we know that there have been about 113 travelers who have tested positive with the rapid antigen test. What we also know is that there is a bucket of individuals who at the 5th day tested negative, and that is roughly about 26,000 individuals tested negative. Now, we get to that bucket of individuals who were not tested. That number, when we just look at it in an absolute sense, seems like a lot. It's a little bit over 43,000. However, we have to look at the data in terms of who was eligible to have the 5-day rapid antigen test done. And when we look at those who are eligible, i.e. those who would have been in the Bahamas 5 days or longer, we see that there's about 21,000 or about 46% of individuals who were supposed to have taken the rapid antigen test but did not take it. So there is a concern there. We certainly need to ensure that individuals who are supposed to take that rapid antigen test actually do take it. But as it stands, the data is indicating to us that there's about 41% of individuals who have stayed 5 days or longer who have not done the rapid antigen test. Thank you.
I have a second question.
Yes. You said 113 people tested positive on day 5 using the antigen test. Can you confirm how many of them were subsequently verified by a PCR test? And are you able to say what percentage of COVID-19 cases since November 1st are believed to be contacts of the positive travel cases?
Okay, certainly I don't have that detail in front of me. I'm not sure if Dr. Brennan or Dr. Moxie, you either. Dr. Brennan, do you have it? Are you able to speak to that?
No.
Okay, so that is an area that we recognize as a gap, and we are seeking to work closer with as Dr. Moxie alluded to, we have to work a little closer with our tourism partners to ensure that we are actually getting these persons tested, and also we are actually, getting, I guess, a little more access to the data to be able to give the true numbers. But we have a robust partnership, so we anticipate that will occur. Mrs. Karen Ferguson.
Happy New Year and good afternoon to you all. Karen Ferguson, Bain Global 99.5 FM. My first question is for Dr. Nakia Forbes. Dr. Forbes, given the data that you've received thus far on the new strain of the COVID-19, what are some of the symptoms that distinguishes this strain from what you've seen in the past?
Good afternoon. Thank you very much for the question. The fact of the matter is this new strain of COVID-19, if you're speaking about the United Kingdom variant, has the same clinical features as other strains that are not that B117 or UK strain. It is going to be very difficult to tell the difference between them clinically because the new strain doesn't portend a worse course of illness, and so then it's hard to clinically distinguish it. Now, how can you suspect that there's an issue? So the whole reason an issue was suspected in the United Kingdom in the first place was because of the rapid spread of COVID-19, making researchers suspect that there was something different. Was it becoming more infectious? So then the sequencing would have shown this new strain, and it rapidly became the circulating strain in London. In a matter of a few weeks, it became the 60% circulating strain. It's very difficult to know that it's here unless you're actively looking for it and you're actively doing testing for it. There's no clinical way to distinguish it.
Thank you, Dr. Forbes. A second question?
Yes. Thank you very much, Dr. Claus, for your answer. My second question is for Minister Wells. Sir, you mentioned in your presentation that the government has secured vaccine for 20% of the population. Minister, given this 20% number, what is the anticipated timeline of the Ministry of Health to have the entire population of the Bahamas, for those who opt to take the vaccine, vaccinated?
Okay, Minister has requested that I answer your question. So access to the vaccine, as you can imagine, is something that we have to take into consideration as we speak about, the entire population. The Bahamas, the government of the Bahamas would have early on made their commitment to actually getting the vaccine for 20% of the population as soon as the vaccine became available. So we continue to work with the World Health Organization and the COVAX facility to get the access to that 20%. And certainly what we are seeking to do is ensure that we are fully prepared. So when we do get that vaccine, we will have our people ready to take the vaccine, and we will also be able to administer the vaccine in a safe way and be able to show that we are able to, we are actually prepared to roll out further to the wider population. Long and short, we can't give you an exact time on that, given all of the factors that go into accessing and also, ensuring that we utilize properly the vaccine once it's in country. Hence our, our advocacy and our reminder that, just getting the vaccine in country is not enough. We have to get our people vaccinated if we are going to stem the tide of COVID-19. So I'm hopeful that that answered your question. Shamarko Lightbourne.
Good afternoon, Dr. McMillan and health officials. Happy New Year to all. My long list has actually just been exhausted by my colleagues, so you can go on to the next reporter. Thank you.
Thank you, and Happy New Year to you. Okay. Tyler Sibonet.
Hello, good afternoon. I wanted to ask if there was anyone present to answer questions related to the Princess Margaret Hospital. I just wanted to know if we could get an update on the morgue and if it's still over capacity and are people still not picking up their loved ones?
Okay, we have Ms. Mary Walker here, and she is moving toward the mic.
Good afternoon, everyone, and a Happy New Year. I can actually indicate that that situation, if anything, has not evolved to where we want it to be as yet. We are still challenged with overcapacity of the morgue at the Princess Margaret Hospital.
Thank you, Ms. Walker. You have a second question?
Yes, I do. Thank you so much for the response, Ms. Walker. My second question is, I know Minister Wells spoke on the impact of the Thanksgiving holidays on the cases, but are we seeing the impact of the Christmas holidays in the cases in country so far, or must we wait a little bit longer to see if there's any significant effect?
Well, there's a 14-day incubate, the cycle. We look at 14 days. So we are still within that period since the Christmas period. And then again, well, we didn't do very much, I hope, on the New Year's Eve. So we have to continue to monitor, and ideally, public health, we like to go 2 cycles, 2 incubation periods. However, we will continue to monitor and make recommendations based on what we see happening. Jasper Ward.
Good afternoon and a Happy New Year.
Good afternoon.
My first question is for you, CMO. Can I get a breakdown as detailed as possible on how the Ministry of Health intends on delivering the COVID-19 vaccine to the public. What individuals would be in that first group of people to get the vaccine? Frontline workers, can you give a breakdown? How will the Family Islands get it? Yeah.
Okay, so we can give you, a high-level breakdown. I think this setting may not be the place for the entire breakdown, but we would have put together a comprehensive immunization national COVID-19 vaccination strategy. Within that strategy, we would have outlined key prioritized groupings, of course, which include high on the list, the healthcare workers, frontline workers, include persons who are at highest risk for actually getting COVID or having worse outcomes for COVID. That is what is included in our strategic document, and we have a phased approach that is proposed to ensure that we, as we access the vaccine, we get those groupings, the highest risk groupings immunized first, and then we continue to move on, including additional groupings. We have a number of work streams under that, and there is a technical working group that Dr. Brennan is chairing, where those work streams actually have a reporting responsibility we meet weekly to get updates on the specifics. One of those groups speaks to the prioritized subgroup as we anticipate, receipt of the vaccine in country. I hope that was...
Just a quick follow-up. What are those work streams? You were quite vague. You just said work streams.
Work streams, as I suggested, those are there's a work stream that's looking at the prioritization of the groups that we will actually vaccinate in the phased approach. There is one that looks at how we will actually engage the service delivery arm to ensure that we are actually, have enough sites and what is happening at each site. There is a monitoring and evaluation component of the actual rollout and what is happening. And there is a safety arm work group that is looking at all that is required to monitor the safety of a vaccine as you do the necessary vaccinations, the short-term, long-term. You have to ensure that we are in a position to track those, and there are one or two other groups that will, certainly there's the budgeting, there is I can't remember all now, but we'll be happy to share with you the full list of work streams for you to be aware.
And my second question, does the ministry intend on buying the vaccine directly from Pfizer, Moderna, or Oxford? And if so, which vaccine?
Minister? Can you repeat?
Does the government plan on purchasing the vaccine directly from either Pfizer, Moderna, or Oxford? And if so, which company are you guys leaning towards?
You want to?
The government of the Bahamas' strategy, as you would know, we've already put down a down payment for 20% with WHO through PAHO's revolving fund. So we're seeking to secure the vaccine through WHO, but the Bahamas government is keeping its options open and looking at its connections directly with distributors of the approved vaccines. And we'll be updating the Bahamian people. The Prime Minister as well will be updating the Bahamian people as we go along in regards to how we're progressing with procuring the necessary vaccine.
Thank you. And in that moment, I was able to actually recall or be reminded of what the additional groups are. So I would have mentioned that we have the service delivery, we have the safety surveillance, we have the actual rollout of the vaccine, which is pretty much the logistics, and including, ensuring the cold chain. We have the prioritization grouping. We have a training and supervision work stream, and we also have, most importantly, demand generation and communications work stream. So those are the key work streams, but also, as I mentioned, we have to look at, ensuring that we prepare the budget, and there's a coordinating component as well. So I just wanted to add that before we move on. Royston Jones.
Hi, good afternoon. My first question is, the United States recorded its deadliest day so far on record since the pandemic just this week. And the UK, based on the new variant, is going into a full-blown lockdown with increased tiered measures. So again, I know this question has been asked earlier this week, but I have to ask again, what is the government's policy on a UK, or at least a travel ban for those coming from the UK? Notwithstanding the fact that we don't have any direct flights from the UK until February, what is the specific policy on dealing with visitors from the UK, given that more and more countries have undertaken these travel bans?
Well, I'll Minister, you want to speak, or I'll?
As it is a policy question, the reality is, as I would have stated on a couple of occasions, we do not currently have any direct flights, as you rightfully said, from the United Kingdom. And a number of countries where we would receive citizens who would transit through those countries, be it Canada or be it the United States, has also instituted various health protocols, from restrictions of persons from the UK coming into the country in regards to Canada, or even the United States, that is requiring an RT-PCR test from persons who are coming in from the UK. You would have those transit individuals already undergoing very strenuous health protocols in those other countries. And if they are then seeking to come into the Bahamas, we have additional health protocols that would help to secure our own circumstance here in country. And so we, from a policy standpoint, have not gone to the next level with the UK, because we, as it stands, the amount of persons coming in to the Bahamas from the United Kingdom potentially is minuscule.
Your second question?
Would you permit me a follow-up question on a matter that was raised earlier concerning rapid antigen tests, just briefly?
Is this your second question?
Not quite, no. Just a follow-up matter on how to enforce rapid antigen testing. I do have a second question after that, if that's possible.
I think we need to move on. If that is something, sorry, I'm not hearing you.
I may be able to take Shamarko's question from earlier, perhaps?
I think you should have had that conversation with him prior. Can we have your second question, please?
Sure. Does the Ministry of Health, given in the first wave, we got details on cases so we can do our own analysis, age, sex, and the location of the cases, whether they were imported or where they traveled from. That process was stopped, I believe, in mid-August as we began to see a surge of cases in the country, and healthcare at the time was, for lack of a better term, overwhelmed. We've not seen those details on cases since then. Now that we've significantly slowed down, and we're, as you pointed out earlier, we're coming to the end of the second wave based on what we're seeing, will the ministry give us those details on those 7,000 plus cases, notwithstanding we got the details on the 104 so far, so 7,000 plus cases? Will we get age, sex, and other details so we can start to do our own analysis of these cases beyond what the Ministry of Health is giving us?
Okay. So that's a very good question. But as you recall, certainly when we began having that surge, one of the challenges was, managing the data. We did eventually move in the direction of having an electronic platform in order for us to be able to manage the data in a more efficient way. I would hazard the guess that the data may have some gaps I have Dr. Moxie who works with that platform on a daily basis. I'm not sure if you would wish to speak to whether or not, how likely we are to be able to, provide that next level on all of the cases. Okay, she's on her way.
Again, good afternoon, and thank you for the question. So you are quite correct. During the first wave, the number of cases were more manageable, and we were able to provide a lot more information to the public. I think as the second wave progressed, we recognized very quickly that we needed to enhance our data management processes, and I think to a large extent we have done that. I know on a daily basis we provide our dashboard updates that are fairly comprehensive. We do have, as would have been projected in CMO's slides, information related or disaggregated information related to location, related to age, related to sex, and many other variables that we could query the data set by. So that information is available, and I do think, again, on a fairly consistent basis through our dashboard, we do attempt to provide that information to you. So my question would be, is there something specific that you are seeking some information, specific information you're seeking to have?
Okay, so I think the long and short, Dr. Moxie would have alluded to us being in a position to, query our database. There may be gaps, but certainly if there are particular things that you are seeking to get, I'm recommending that you email our communications unit or get in touch with our communications unit, and we will see how we are, as best we can provide that analysis to you. So I think that is the end of our list of questions and persons who requested questions. So I thank you all, the media, and I thank the general public for listening in. And certainly we anticipate having updates in the future. And I wish you all a lovely afternoon.